Hi, welcome to the Vanderhoof Endoscopy Scope Group. I'm Dr. Batchelor. I'll be guiding you through this session today. Today we are going to discuss a number of things. We're going to discuss what to expect, why we do scope groups, who we are, what we do, what endoscopy is, how to prepare for an endoscopy, and what to expect the day before, the day of, and after you've had an endoscopy. So, what to expect out of today? Today we're going to go through a short presentation on the endoscopy service in Vanderhoof. After the presentation, you're going to meet one-on-one with a physician, either myself or Dr. Ebert, and we will look over your case. We will then determine whether or not you need an endoscopy, and if so, in what time frame. After you meet with either one of us, you will see one of our medical office assistants, and they will actually book your endoscopy today. One question we often get asked is why we do scope groups. Well, it's all about wait times. Myself and Dr. Ebert are family practitioners who have extra skills in surgery and anesthesia. Though we do clinics, we don't do many. Thus, to see everybody here today in our clinics, it would take approximately 3 to 6 months. Instead, we are going to do this in an hour and a half. In addition, you will also get information on endoscopy today, and you will actually have your scope booked today. We know that some of you have been to a group session before and wonder why you have to come back. This is because this is the only way to keep track of all the patients in our busy endoscopy practice. So, the bottom line is that we want to reduce the wait time between you seeing your family doctor and getting your endoscopy performed. Who are we? Well, Dr. Ebert and Dr. Batchelor, like I said, are family practitioners who have taken extra training in endoscopy. We are not specialists in gastroenterology. If your family doctor thought you needed to see a specialist in gastroenterology, a referral would have been sent to a gastroenterologist somewhere in British Columbia. What do we do? Well, we provide an endoscopy screening service. What this means is that your family doctor wants to know whether or not your symptoms could be caused by something we would see on endoscopy. We then meet with you today and determine whether or not we agree that something like that could be seen on endoscopy and whether or not you would be a good candidate for a scope. We then perform the endoscopy and send the results to your family physician. You'll sometimes give recommendations to your physician based on the findings on your endoscopy, but usually your family physician will follow up with the results, similar to when they order a CT scan or an ultrasound. What is endoscopy? Endoscopy is the use of a fiber optic camera on the end of a long tube to look inside the gastrointestinal tract. Here we have a picture of the colon. The colonoscope has been passed through the colon to the end here. This is the head of the colonoscope. It has an instrument channel, a light, an irrigation port, and a video camera with which we are able to look at the walls of the bowel. In this picture here, we can see what we usually see when we do a colonoscopy. This is a sample video of what we see on a colonoscopy. As you can see here, these are the walls of the bowel, as the colonoscope is being withdrawn from the colon. What are we looking for? Well, on a colonoscopy, we are most commonly looking for polyps. Polyps are like moles on your skin that grow in the intestine. Some of them could potentially become cancer. Some signs and symptoms of polyps are change in bowel habits, rectal bleeding, or abdominal pain for which you cannot find a cause. In addition to this, your family doctor may have ordered a test called a FIT test, which looks for blood in your stool that's not visible. If it's positive, there could be polyps in your colon. When we do a colonoscopy, we can remove the polyps during the colonoscopy, and they may never become cancer in your lifetime. In addition to this, we also occasionally look for diverticulosis. These are little outpouchings on the bowel caused by pressure over time. Symptoms of diverticulosis can be rectal bleeding as well as pain, usually in the left lower quadrant of your abdomen. We also look for inflammation in people who have had diarrhea for a long period of time and for which they cannot find a cause. Rarely, we find cancers on a colonoscopy. The most common reason we do gastroscopes is when people have heartburn that's not controlled with medication. In this circumstance, we often find inflammation, as you can see in the top left corner here. We will then take samples of the tissue and send it to a pathologist who will look at it under a microscope. We will then get a better idea, microscopically, of what's going on to help better treat your symptoms. There are other things we look for on a gastroscope. For example, strictures. In people who are having difficulty swallowing, they may have a stricture. A stricture is a web of tissue that has lost its elasticity and doesn't allow food to pass easily. Another thing we commonly find is something called a hiatus hernia. A hiatus hernia is a portion of the stomach that moves above the diaphragm, as you can see down here, in which food can get stuck and cause either bad breath or heartburn. In people who have long-standing heartburn, you can get something called Barrett's esophagus. This is changes in the esophageal tissue that can be a precursor or increase your risk for getting esophageal cancer. In people who we suspect may have some gastrointestinal bleeding, we often find ulcers, which you can see down here. There are 3 important things we'd like you to take home from the session today. First is the prep, namely for the colonoscopy. For us to see what we need to, the entire bowel needs to be cleared out. We will be going through the instructions for the prep today. Don't worry about writing them down. You will get an information sheet on how to do the prep prior to leaving the session. Secondly, you need a driver to drive you home from your procedure. Everybody who has an endoscopy in Vanderhoof will have some form of sedation. Thus, you will be legally impaired for 24 hours. If you work, you may need to take the next day off if that 24 hours falls in that window. Finally, if at any time you realize that you can't have your scope done, please let us know well in advance. You will be given a phone number to call if this is the case. In addition to this, you will also get a phone call 1 week prior to your procedure. This is to remind you that you're having the procedure done, and some of our wait lists can be up to 6 months prior to getting an endoscopy performed. We are now going to go over the endoscopy prep. The prep for the gastroscopy is really quite simple. You just don't eat anything or drink anything past midnight the night before your procedure. On the morning of your procedure, you do not eat or drink anything, but you can take the medications according to what we talk about today. The colonoscopy prep is a little bit more involved. There are 3 things we use for the colonoscopy prep: docusate sodium, picosalax, and citromeg. You're going to need to purchase these from the pharmacy. If you have coverage, you can get a prescription for us for these medications. On the day before the prep day, which is 2 days before your colonoscopy, you're going to eat a light supper, and you're going to take 4 docusate sodium tabs at bedtime. On the prep day, which is 1 day before your colonoscopy, you can only drink clear fluids. This means no solids or milk products. Approved clear fluids are non-pulp fruit juices, clear broth or bouillon, black tea, black coffee, soft drinks, Kool-Aid, Jell-O, and popsicles. You are going to need to drink at least 4 liters of clear fluids in the 24-hour period of your prep. At 8 a.m. in the morning, you're going to mix the first sachet of picosalax in 5 ounces of cold water. Stir well until dissolved and drink. You are going to follow this with at least 1.5 liters of water. At noon, you're going to mix the second packet of picosalax and follow this with another 1.5 liters of clear fluid. At 4 to 6 o'clock in the evening, you're going to drink 1 bottle of citromeg. You will then continue with clear fluids. You can take all the medications that you would normally take during the day, and you will have nothing to eat or drink after midnight of the day of your prep. This means nothing by mouth at all. No breath mints, chewing gum, or fluids until the procedure is completed. On the morning of your procedure, you cannot eat or drink anything, but you can take your medications according to what we talk about today. In terms of the medications you can or cannot take, we allow people to take any heart or blood pressure medications in addition to any puffers that you might have if you have COPD or you have asthma. In addition to that, anybody on insulin or warfarin, we will talk to you today specifically about what you can or cannot take. Make sure you're on time, and please bring a person to drive you home, as we have discussed previously. Please do not bring small children, as we cannot take care of them during your procedure. Do not worry about writing any of this down, because you will get this exact information sheet at the end of the session today. Now for some housekeeping items. I'm not going to go through everything on this sheet, because you will get a copy prior to going home today. I would like you to remind you to bring all your medications to the hospital the day of your procedure, because you will be able to take them after the procedure. Do not wear nail polish, makeup, jewelry, contact lenses, or perfume to your appointment. Make sure to wear comfortable, loose clothing that's easy to remove. There are a few things we would like to make sure that you tell the doctor when you see him today. First, if you're taking insulin. Second, if you're taking any warfarin or any other type of blood thinner aside from aspirin. Finally, make sure you tell the doctor if you've ever had any abdominal surgeries, including a hysterectomy or a C-section. On the day of your procedure, make sure you show up at the hospital at the allotted time. You will get this time prior to leaving today. It will be written on the sheet you go home with. On the day of, you will be directed to the post-anesthetic recovery room, where you will meet one of our nurses. They will put an IV in your hand and put you in a gown. When it is your turn, you will be wheeled into the operating room, where either myself or Dr. Ebert will be standing, waiting for you. We will once again review your case and answer any questions you might have. We will then place you in the position for the procedure, give you an anesthetic, and perform the procedure. Afterward, you will be sent to the post-anesthetic recovery room, where you'll get a sheet of information from us telling you what we found, who to see, and when. There's one final thing we're going to go through today, and it is something called informed consent. Informed consent means that we have discussed the risks, benefits, and expectations of the procedure with you, and that you have agreed to have it performed. Colonoscopies and gastroscopies, on a list of all surgical procedures, are considered low-risk procedures. However, they are not considered no risk. This is our informed consent form. We will be getting you to sign this today, should we choose to proceed with an endoscopy. This is not meant to scare you, only to give you informed decision-making around having a procedure done. The most common side effect from having a colonoscopy or a gastroscopy is abdominal pain and swelling. This is because we inflate the bowel with gas to do the procedure. Once the gas is released in the post-anesthetic recovery room, usually this goes away. Some people get bleeding when we're doing the procedures, namely when we're doing colonoscopies and working around the rectum area and taking tissue samples. It is extremely rare that anybody would ever get major bleeding with one of these procedures. In rare cases, you can get a bowel injury from one of these procedures. In the general population, it's 1 in 2,500 colonoscopies and 1 in 4,000 gastroscopies. Your risk for this may increase if you're female, over 75, have ever been diagnosed with diverticulosis, or have had any previous abdominal surgeries, including a C-section or a hysterectomy. If you have any concerns or questions about what is on this form, please let us know prior to signing it. Well, that about wraps it up. Next, you're going to wait in this room until it's your turn to see the doctor one-on-one. When you see the doctor, we will review your case and determine whether or not you need an endoscopy. If so, you will then see one of our medical office assistants who will book the procedure for you. They will then give you an information sheet with all of the things that we have covered today. Thank you again for coming, and have yourself a good day.